Hey, this is Gary Orris. I'm going to do another video for Medical Second Opinions. And I have with me today Earl, who's with me walking on the beach today. So what I want to talk today about down here at St. Simon's, a little foggy, is vaccines. I do think we over-vaccinate. Used to, the doctors gave the vaccines and we would oversee what people got. In about a 5-year time, the pharmacies, which have better lobbyists and a lot more money than we do, realized how much money there was in giving the vaccines. And so they push multiple vaccines on anybody and everybody they can give them to, because it's all about the dollar when it comes to pharmacies. I do think a lot of the vaccines are unnecessary. Why do we vaccine against some diseases that are really not that big a deal? Hepatitis A is an example. Less than 1% of the people that get hepatitis A does it become a significant issue. My wife took our kids to the pediatrician to get their routine checkup. My wife comes back and says that Nick got his hepatitis A vaccine. Why did he get that? I mean, that's not a big deal. And she said, I don't know. So I called the pediatrician. I asked her, I said, why did Nick get the hepatitis A vaccine? With confidence, she said, well, the American College of Pediatrics recommends it. I said, I didn't ask who recommended it. I asked why they recommended it. She didn't know. She told me that. She didn't know. So she's in her office administering to hundreds of kids a vaccine that she doesn't even know why they give it. And I think that's a common scenario out there, that it's all about giving it rather than let's stop and think, is this really necessary? So next vaccine is COVID. Needless to say, with my history, you probably know, I do not support the COVID vaccine now or never. No matter what your age, I don't think you should be getting the COVID vaccine. When I consider the vaccine more dangerous than the actual virus, that's when I can't, with good conscience, recommend it to anybody. Next is RSV vaccine, respiratory syncytial virus. In 30 years at the ER, I never admitted a single patient that had the diagnosis of respiratory syncytial virus pneumonia as an adult. Now, with young kids, yeah, I had a few of those. And they sometimes would get admitted, not always. But adults, even the CDC says 98% of adults have had RSV at some time in their life. So I don't really care. I mean, the ER test for all of the viruses as soon as you walk in the door. I don't care if you got RSV. I want to know how you're doing. If I can make you better and send you home, I don't care if you got it. So again, that's a vaccine I will never get. If you have underlying lung disease, pulmonary fibrosis, pulmonary hypertension, COPD, it might be a good idea to get that. But for the average person out there, no, I'm not promoting that. Next vaccine is the pneumonia vaccine. Now, everybody thinks, well, this treats all pneumonia. I won't get pneumonia if I get this vaccine. No, it treats one bacteria. And it can be a rather aggressive bacteria, but if you get a cough and fever, come see me. I have antibiotics that can treat it also. I have not gotten it, and I won't get it. Like I said, if you have underlying lung disease, it might be a good idea. If you don't have a spleen, that is a definite. You need this vaccine. Next is the shingles vaccine. I don't really promote it. It's not a life or death type situation with it, so I don't make a big deal out of it. If you get it, you're going to hate that you had it. So if you're worried about getting shingles, you had to have had chickenpox to be able to get shingles. Early symptoms of shingles is painful just to light touch on the skin. And then a rash shows up a few days later. So it can be treated with medication also, but it has to be within a 72-hour window of the onset of the rash. So you definitely don't want to wait on that. So it will reduce your risk of getting it from 30% from the normal population if you don't get the vaccine to 3% if you do get it. So there is still a small risk. So those are just the vaccines that I'll discuss today. The problem with them is there are some vaccines that are a good idea. Sorry, Earl's making me turn around here. And the pharmacies don't make that clear. The CDC doesn't make that clear. And they're just pushing everything they can. I actually read an article recently that said that antimicrobial resistance is building, and the way to treat it, of course, more vaccinations. And that way you won't have to worry about putting people on antibiotics because there'll be vaccines treating everything. I think some illnesses, even mild ones, help build your immunity. So in closing, my concern with the vaccines are when physicians, pharmacies are not looking out for the best interest of the patient. If your pediatrician demands you to get so many vaccines, you need to reevaluate who your pediatrician should be. So have a great day and hope you have a happy new year.